Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to my channel HealthMatrix. My name is Dr. Ahmed Raza. Today my topic is viral fever versus bacterial fever in children. Many parents ask an important question when their child has fever. Is this fever is viral fever or bacterial fever? So in this video, I will explain the difference between viral and bacterial fever in children in a simple and clear way so you know when to relax and when to worry. First, we discuss what is viral fever. Viral fever is caused by a virus. It is very common in children and usually spread through cough, sneezing, or close contact. Common features of viral fever are mild to moderate fever, cough, cold or running nose, body aches or headache. Child may still be active, and fever usually lasts for 2 to 3 days. In viral fever, the body fights the infection on its own. There is no need for antibiotics in viral infection. What is bacterial fever? Bacterial fever is caused by bacteria. It is less common, but can be more serious if not treated properly. Common features of bacterial fever include the high grade fever, the fever lasting more than 2 to 3 days, child look very sick or weak, poor feeding or refusal to drink, localized infection in the throat, ear, chest, or in the urine. In bacterial infections, antibiotics may be required, but only after the proper medical evaluation. Now let's compare the viral and bacterial fever in very simple terms. Viral fever usually improve in 2 to 3 days. On the other side, bacterial fever lasts longer than 2 to 3 days. In viral fever, the fever responds well to the paracetamol, while the bacterial fever may not be respond to paracetamol. Viral fever has cold and cough, while the bacterial fever may have severe pain or pus. In viral fever, there is no need to give antibiotics. On the other hand, the bacterial fever may need antibiotics. These are the simple differences which help the doctors to decide the next step. What should the parents do if their child has fever? Give paracetamol according to the child weight. Encourage fluid like water or oral rehydration salt. Do not give antibiotic without doctor advice. Do not panic but observe the child closely. Always remember, fever is a symptom, not a disease. Now we discuss when should the parents worry. You should take your child to a doctor immediately if the child fever lasts more than 3 days, if the fever is very high, if the child is very sleepy or difficult to wake, or if the child is not drinking enough fluids, if there is repeated vomiting or difficulty in breathing, or there is any rash on the body, or convulsions or fits. These are the warning signs and should never be ignored. If you have not watched my first video on fever in children, when to worry, please check it on my channel. For more Doctor Explained health videos, please like, share, and subscribe to my channel HealthMatrix.